They called it a hospital. The federal government called it something else entirely. At a joint press conference held outside the Dade County Federal Building, the special agent in charge of the FBI's Miami Field Division stood behind a podium lined with seized evidence bags, stacked cash bricks wrapped in federal seizure tape, and enough prescription bottles to fill a pharmacy warehouse. He leaned into the microphone and said 5 words that made the entire room go silent. This was not a hospital. What investigators uncovered inside the walls of Coastal Meridian Medical Center, a private hospital sitting in the heart of Brickell, Miami's gleaming financial district, was not a place of healing. It was, according to federal prosecutors, the most sophisticated narcotics distribution network ever disguised behind a medical license in the history of South Florida. Over $31 million in cash. Over 400,000 fraudulent opioid prescriptions. And at the center of it all, one man, a fictional character we will call Dr. Emilio Vargas, director of Coastal Meridian Medical Center, who had quietly turned a legitimate healthcare institution into the American Nerve Center for a Colombian drug cartel operation that stretched from the streets of Medellin to the prescription pads of Miami's wealthiest zip codes. And the next part is worse, because the hospital was only the beginning. It was 4:47 in the morning when the first units moved. Miami was still dark, the kind of thick, humid darkness that South Florida wears like a second skin before the sun burns it away. Brickell's glass towers threw fractured neon reflections across the wet pavement below. The Biscayne Bay sat silent in the distance. There were no sirens, no flashing lights, nothing that would warn anyone inside that this morning was the last morning the operation would ever run. Over 200 federal agents moved simultaneously across 7 locations in Miami-Dade and Broward counties. FBI tactical units in full tactical gear, ICE Homeland Security investigations teams, DIA narcotics strike teams, and SWAT elements from the South Florida High-Intensity Drug Trafficking Area Task Force converged like a tightening fist. Black SUVs rolled without headlights for the final 2 blocks. Helicopters held position at altitude, dark and quiet, their thermal imaging feed streaming live to a command center 20 miles away. The main target was Coastal Meridian Medical Center on Brickell Avenue, but agents were also hitting a private pharmaceutical fulfillment warehouse in Doral, a network of pill mill clinics operating under Shell Medical Group names in Hialeah and Opa-locka, a waterfront penthouse in Coconut Grove connected to Vargas personally, and a document processing office in Coral Gables that on paper handled medical billing, but was, in reality, laundering millions in cartel cash through falsified insurance reimbursements. At exactly 4:52 a.m., the word came over encrypted federal radio. Go. The front entrance of Coastal Meridian went down hard. Flashbang grenades lit the lobby like daylight for half a second. Agents in black poured through the automated glass doors before the smoke had cleared. Security staff were ordered to the ground immediately. Administrators who had been sleeping in on call rooms were pulled into hallways at gunpoint. In the sub-basement pharmaceutical storage wing, a floor that did not appear on any of the building's publicly filed architectural plans, agents found what they had come for. 12 steel, reinforced shelving units stacked floor to ceiling. Hundreds of thousands of oxycodone tablets, hydrocodone in quantities that made agents stop walking and just stare, fentanyl patches, fentanyl lozenges, and nearly 80,000 fentanyl pills mixed inside standard pharmaceutical packaging designed to look like legitimate hospital inventory. DIA field agents on scene estimated a street value exceeding $14 million from the pharmaceutical storage floor alone, but it was what they found in a locked server room adjacent to the pharmacy director's office that changed everything. Behind a false wall panel, accessed through a biometric lock that took the FBI's cyber unit 11 minutes to bypass, agents discovered 4 encrypted server towers, 2 external hard drive arrays, and a single sealed titanium briefcase containing what federal investigators would later describe in court filings as the most complete cartel financial architecture they had ever recovered from a domestic operation. The briefcase had a name embossed on its interior lining in small, precise letters. Proyecto Blanco Clínico. Operation White Clinic. The operation had a name. And it had been running for 7 years. By 9:2:00 that same morning, inside the FBI's Miami Cyber Forensics Division facility in Miramar, analysts were already cracking the first layer of encryption on the recovered servers. What they found was not just a ledger. It was a map, a sprawling, meticulously maintained digital architecture showing the complete financial and logistical framework of a Colombian drug cartel's American medical operation. Analysts described it later as looking, at first glance, like a legitimate hospital network administration system. The kind of software a large regional healthcare group might use to manage patient flow, billing, and inventory, except every node on this network was a ghost. Every entry was a transaction. And every transaction traced back to one of 16 shell corporations registered across Delaware, Wyoming, Panama, and the Cayman Islands. The cartel had not simply used the hospital to sell drugs. They had built an entire pharmaceutical underworld inside it. Fictional company names like MedCore Solutions LLC, BioRoute International Partners, and Sunrise Healthcare Fulfillment Group appeared across thousands of transactions. Each company existed on paper, had a registered agent, paid filing fees, and maintained a professional website. None of them had a single real employee. Together, they formed a layered financial corridor that moved cartel cocaine and synthetic opioid profits from street-level distribution networks in Liberty City, Overtown, and Carroll City, through falsified medical billing claims submitted to Medicare and private insurers, through the shell companies, and finally into offshore accounts in Panama and the Cayman Islands before cycling back as clean investment capital into South Florida real estate and private equity. The numbers inside Operation White Clinic were staggering. Federal analysts calculated that the network had processed approximately $62 million in laundered proceeds over its operational lifetime. The $31 million seized on the morning of the raid represented roughly half of what remained in active accounts and physical cash stores. The rest had already moved offshore. And then the analysts found something that made the room go quiet. Inside a deeply encrypted partition on the primary server tower, a partition protected by a separate 12-character alphanumeric key that the FBI cyber unit cracked only after 6 hours of continuous work, was a directory of authorizations. Not financial authorizations. Operational authorizations. Every major shipment of Colombian cartel narcotics that had entered the Coastal Meridian distribution network over a 4-year period had required a digital sign-off from a single encrypted user credential. The credential was tied to a private encryption certificate registered to one name, Dr. Emilio Vargas, Director of Coastal Meridian Medical Center. This was not a hospital administrator who looked the other way. This was not negligence, and this was not a man who had been coerced into participation without understanding what he was part of. This was command-level authorization. Every fentanyl shipment, every opioid distribution order, every laundered insurance reimbursement, Vargas had personally approved them, authenticated them, and in some cases added operational notes inside the encrypted directory like a surgeon charting a patient's treatment plan. Except his patients were cartel logistics routes, and his treatments were drug shipments moving up the east coast of the United States. Analysts began pulling the thread further, and what came next made it clear that what they were looking at was not just a corrupt hospital director. What they were looking at was the American operational headquarters of a Colombian drug cartel that had found a way to move narcotics, launder money, and evade federal detection by hiding inside the one institution that Americans trusted more than almost any other: the healthcare system. The operation was not finished. It had barely begun. At 5:30 the following morning, the second phase of the federal takedown launched from a unified command center established at the Miami-Dade Police Department Special Operations Building in Doral. The digital map on the main briefing screen showed 43 red markers pulsing across Miami-Dade, Broward, and Palm Beach counties. Each marker represented a location with confirmed ties to Operation White Clinic. Each location was assigned a federal strike element. Over 600 federal agents, ICE-SI officers, DIA tactical personnel, FBI SWAT teams, and DA's enforcement units were deployed across South Florida in a coordinated sweep that the special agent in charge would later describe as the single largest simultaneous law enforcement operation in the history of the Miami Field Division. Black Hawk helicopters from the DIA's Miami Air Wing flew overwatch across the primary target clusters. Coast Guard fast response cutters were positioned offshore to intercept any attempt to move assets or personnel by sea. Within 4 hours, the results were catastrophic for the network. In Doral, the pharmaceutical fulfillment warehouse yielded an additional 230,000 opioid tablets, 40 kilograms of cocaine-bearing chemical markers linking it directly to a Colombian production region. and $612,000 in cash packed into commercial shipping boxes labeled as medical supply inventory. In Hialeah, 3 pill mill clinic locations were shut down simultaneously. Clinic staff, including physicians operating under falsified medical licenses, were taken into federal custody. Patient files, which investigators confirmed were almost entirely fabricated, were seized as evidence of large-scale Medicare fraud totaling an estimated $22 million across 3 years of false billing. In Coconut Grove, at the waterfront penthouse connected to Vargas, agents found a secondary financial operations room hidden behind a custom-built closet wall. Inside were 2 additional encrypted laptops, approximately $4 million in cash stored in vacuum-sealed bundles, and a collection of prepaid international SIM cards with recent call records to numbers traced to Medellin, Cali, and Barranquilla in Colombia. There were also handwritten operational notes in a mixture of Spanish and English that referenced upcoming shipments, described distribution contact protocols, and contained what appeared to be the names and positions of individuals within South Florida's medical and financial sectors who were described in the notes as recursos confiables, trusted resources. The document processing office in Coral Gables was perhaps the most chilling discovery of the second phase. Inside what appeared from the street to be a standard medical billing firm, agents found a full-scale financial fabrication operation. A team of 12 individuals, most of them working under fraudulent identities, had been generating thousands of false Medicare and insurance claims per month, submitting them through the shell companies, receiving reimbursements, and filtering the money through multiple banking layers before it exited the country. The technical sophistication of the fraud operation was, according to federal financial crimes investigators, comparable to the most advanced Medicare fraud schemes ever prosecuted in the Southern District of Florida. And this was just the money cleaning engine. The drugs were a separate operation entirely, running in parallel. In 6 hours, the underworld infrastructure that Vargas and his Colombian cartel partners had spent 7 years building had taken more damage than it could survive. The deeper investigators went into the seized servers and financial records, the more they found that the corruption extended well beyond Coastal Meridian's walls. Encrypted communication logs recovered from Vargas's personal devices revealed payments to 4 licensed pharmacists in Miami-Dade County who had been authorizing the release of controlled substances outside standard dispensing protocols. 2 licensed physicians connected to the pill mill network had been receiving monthly cash payments through a shell company payroll system disguised as medical consulting fees. A licensed pharmaceutical distributor representative had been altering shipment documentation to conceal the volume and destination of controlled substance deliveries to Coastal Meridian. But the most disturbing discovery came from a cross-reference analysis of the seized billing fraud data against DIA prescription monitoring program records. Investigators found patterns showing that thousands of fraudulent prescriptions had been written in the names of real Miami area patients, many of them elderly Medicare recipients who had no idea their identities and medical records were being used to generate fake opioid prescriptions. Real people. Real Social Security numbers. Real Medicare beneficiary IDs. Being used as the paper infrastructure for a Colombian cartel's pharmaceutical distribution network. Honest investigators who had spent careers working South Florida healthcare fraud described what they were seeing as something they had never encountered before. Not just fraud, not just drug distribution. A second, shadow pharmaceutical system running beneath the legitimate one, using the same licenses, the same regulatory frameworks, the same billing codes, and the same trust that patients placed in the healthcare system, and turning all of it into a mechanism for moving narcotics and laundering cartel money. One senior DIA analyst, speaking on background to federal prosecutors, described it in 4 words. They wore the white coat. The system would need to be rebuilt from the prescription pad up. When federal prosecutors mapped the full scope of Operation White Clinic against known Colombian cartel distribution intelligence, what emerged was a picture of a network that was never meant to stay confined to Miami. The shell company financial architecture had active connections to cartel-linked entities in Atlanta, Charlotte, and New York. Shipping manifest irregularities connected to the Doral warehouse suggested that pharmaceutical-grade narcotics had been moving northward through commercial trucking contractors along I-95 for at least 2 years. Port records from the Port of Miami showed a pattern of container shipments from Colombian ports of origin that, when cross-referenced with the warehouse's inventory records, suggested narcotics concealed within medical supply shipments had been entering South Florida with a regularity and volume that federal authorities had not previously detected. The Colombian cartel had not simply found a corrupt doctor in Miami. They had identified the American medical system as an infiltration vector, engineered a years-long strategy to embed themselves inside it, and used it to build a distribution and money laundering infrastructure that was, in many ways, more sophisticated and more durable than anything they could have built on the street. Because the street gets raided. The street gets surveilled. But a hospital, a licensed, accredited, Medicare-participating hospital in one of America's wealthiest urban corridors, moves through the world wrapped in an invisibility that no street corner can provide. There was a final file on the primary server, a planning document, partially encrypted but largely recovered by the FBI cyber unit, that outlined what federal prosecutors described as the next expansion phase of the operation. New clinic locations, new shell company structures, new physician recruitment targets. It was not a contingency plan. It was a growth plan. Vargas and his cartel partners had not been running a criminal operation inside a hospital. They had been building a cartel-controlled medical empire, and Miami was only the first location on the map. The system was not infiltrated. It was being redesigned for a cartel future. Dr. Emilio Vargas was arrested at 6:14 in the morning on the day of the first raid, taken into federal custody at his Coral Gables residence by a joint FBI and ICE team. He was escorted in handcuffs past the same waterfront view he had used for 7 years as the backdrop to a criminal enterprise that destroyed lives at the same address where it claimed to be saving them. He faces charges including drug trafficking conspiracy, healthcare fraud, money laundering, illegal distribution of controlled substances, and conspiracy to defraud the United States government. If convicted on all counts, he faces multiple life sentences. But here is what you need to hold on to after this story ends. The fentanyl that moved through those hospital corridors did not stay in a hospital. It moved into neighborhoods. It moved into homes. It moved into the arms of people in Liberty City and Overtown and Carroll City and up the coastline into communities that never knew a pharmaceutical cartel was operating behind a medical license 15 miles away. Real people died with prescription bottles in their hands that traced back to this building. Real families buried children whose death certificates said overdose, but whose actual cause of death was a system that had been engineered by a man in a white coat and a cartel that saw human suffering as a business model. Power does not always need open violence. Sometimes it only needs a medical license, a billing code, and the assumption that nobody is looking. This story is a warning about what organized crime does when it stops operating in the shadows and starts operating behind the institutions we trust. About what corruption looks like when it wears professional credentials instead of criminal tattoos. About how quickly a system built to heal people can be turned into a mechanism to harm them when the wrong person is given authority over it and the right cartel is willing to invest in the infrastructure. If you are still watching this, tap like so this story reaches more people who need to understand how deep this goes. Comment expose if you believe this kind of corruption needs to be dragged into the light and prosecuted to the absolute limit of the law. The arrests have been made, the cash has been seized, the servers have been cracked, but the networks they revealed stretch far beyond one hospital, one director, and one morning in Miami. The investigation continues.